completing your stage 1 total knee replacement exercises. Today in this video I'm going to talk you through your stage 2 exercises, starting with the mini squat. So the aim here is to have a nice solid surface in front, a big chair, table or a kitchen worktop, spacing our feet out nicely and just making sure lowering ourselves down and coming back up. Again, it's very important to have a good knee bend after a total knee replacement, so we need to make sure that as and when we can push a little bit further without it becoming painful, that we do. The aim here is to go for a minute, and if you feel like you're capable of doing more, then doing a little bit longer as well. That's it, keep following along, and we'll do a couple more. Excellent. So the next exercise I'm going to show you a couple of variations of is the knee bend. So the one we can do standing up is hands in front of us again on the chair and just picking our heel up towards our bottom. This one may be quite difficult against gravity to start with in that initial phase. But again, if you're able to manage this one, it's a good one to get that knee moving and bending well. The alternative is to have it sitting in the chair. So the aim here is to allow our foot to slide out and then bringing it back and trying to tuck it under the chair. So again, allowing it to come out nice and straight, taking it through a good range of motion and tucking it under. Whichever variation you choose, aiming to do it for a minute and then pushing to 2 minutes. A nice technique, be popping a plastic bag under and then using your good leg to just try and help push it a little bit further each time, because ensuring we get a good range of motion is going to help you to achieve a lot of daily activities a lot easier. Okay, moving on to the next exercise, calf raises. So again, that solid surface in front, and we're just looking to come up on our toes, big squeeze at the top and back down. And again, up on our toes, big squeeze at the top and back down. Making sure all movements are nicely controlled. Don't want anything bouncing up and down or anything too jolty that might cause pain in and around the new joint. That's it. Keep going. Lovely. Excellent. The next exercise we can do, again, is just a pendular swing. There's a couple of variations you can do, and I'll show you the one in the chair after. But this is very similar to that knee bend. It's just allowing our leg to swing back and forward, making sure we're keeping a good range of movement and keeping the joint nicely nourished. Again, nice straight and upright on this side here. I'm not bending over, I'm not leaning backwards. We're trying to keep nicely aligned. And I'll now show you the variation in the chair. Again, very similar to the hip and very similar to the knee bend. It's just having your hands underneath and allowing it to swing freely. This movement here is not so much about contracting and relaxing really hard. It's about just allowing our knee to bend through a nice range of movement and keep it moving nicely. Again, making sure that we're doing our exercises throughout the day, at least 3 times a day, aiming for that 1 minute per exercise, because these exercises will gradually allow you to get back to your walking and your hobbies a lot easier. All right.